So we're just going to show some bony soft tissue palpations when we do kind of like a basic knee exam. So the first thing we're going to do is start with our anterior depressions. So where I put my thumbs here, so they're in the depressions where we can follow kind of eventually into some other anatomical structures. I'll talk about in a second. So this is my starting spot. Ready? So I've got my anterior depressions, and then if you could look at between my two thumbs, then are going to be your patella. And then you go up to where the patella attaches on the inferior pole of your patella. So you got the inferior pole of the patella, you got your patellar tendon, and then if we come down a little bit further, we've got the tibial tuberosity. And then going back to here, I'm into my depressions. And then I can actually, if I bend the knee up just a little bit more too, I can kind of follow or feel the condyle of the femur on the medial side, and then the lateral one I can feel it a little bit, but the patella kind of gets in the way right there. So what I'm going to do real quick is do this, where I'm going to outline the patella. I'm going to go ahead, and these little circles here are going to be my depressions, and then this will be my patellar tendon to my tibial tuberosity. Hey, we're drawn. And then if we follow like the edges of the bone, in this case the condyles, and I'm just kind of trying to draw this, it might not be exactly the true form, but we've got the condyle here, and then we've got this flat surface represents the plateau or flat surface of the tibia. So it'd be the same thing on the lateral side, where I can feel it just a little bit there, and then right there. And again, I've kind of drawn a little bit bigger so you get a perspective, but what we do is we can go back into our depressions, and then if you're good at using your fingers, whether I like to use my thumbs, but I actually take this thumb, then I go over here like this, and I find the separation between that round part of the condyle and then the flat part of the tibia. And then what I do is kind of drive my finger into that area, and I kind of feel like I'm in this groove. Well, I'm in, then that would be the medial joint line. And what's in the medial joint line then is your medial meniscus, and then of course your MCL if you can find that. And then if I go around to the lateral side, same thing here. So if I like to take my hand, so I'm going to follow that round condyle of the bone right there, and the flat part of the tibia, and kind of jam my thumb. I like to use that surface of my thumb into the lateral joint line. In that case, then I'm going to be right over the excuse me, the lateral meniscus, and then your lateral collateral ligament. And I'll show it in a couple other videos how to find some of these other things too as well. All right, so we'll stop there.